We'll go ahead and get started. Welcome, everybody, and thank you for attending. With us today, we have Dr. Keyonna King, who has a doctorate in public health with concentration in preventive care from Loma Linda University and a master's in psychology with a clinical emphasis from Pepperdine University. Dr. King is one of the first recipients of the prestigious Bill and Melinda Gates Millennium Scholarship. She has worked closely with one of her mentors, Dr. Suzanne Montgomery, on mixed methods research designs and has extensive experience utilizing the community-based participatory research approach with minority communities. Dr. King is an assistant professor at the University of Nebraska Medical Center in the College of Public Health, Department of Health Promotion. She practices the CBPR approach to engage community in projects to address health disparities. Typically, she partners with the North Omaha community to address priority health needs identified by the community, such as mental health, chronic disease intervention, and prevention violence, and improving the diversity of the healthcare workforce. Dr. King focuses her personal research efforts on using CBPR to understand and address depression in African American men and improving mental and physical health outcomes for African and Native Americans. We ask that you reserve your questions until the end of the presentation. Please welcome Dr. King.
Thank you so much. Let me go ahead and share my slides. Can you all see that?
Yep.
Awesome. All right, thank you again for the lovely introduction, Ms. Heather. I'm gonna jump right in because I have a lot that I wanna try to cover in a short period of time, but also wanna give you a little teaser for what we have to come, as I am also the Director of Community Engagement and Outreach for the Great Plains IDEA CTR. So what I hope to accomplish in this presentation today is first to really describe to you the historical background of CBPR, also being able to describe the rationale for why we even leverage or use CBPR in research. And then of course, the CBPR principles, I want to define those for you all as quickly as I can, because there are 10 of those. And then lastly, I want to be able to share a couple of examples of how CBPR principles can be applied in research. So before I get started, I know some of you have probably already heard me talk several times about community engagement, but I love this figure. I think it does a really good job of describing the different levels of community engagement that can happen. And so the lowest level of community engagement is outreach, and then the highest level is what is called shared leadership, also known as community-based participatory research, or CBPR. And today, I'm only going to focus on the shared leadership level of community engagement. If you want to learn more about the other levels, I have a plug for you at the end of my talk to help you get a little bit more acquainted with those levels. So how are we defining CBPR? CBPR is really the increased knowledge and understanding of a given phenomenon, and it's allowing us to integrate that knowledge and understanding into interventions that could either be used for policy or social change that ultimately benefits the community members. I want to stress the emphasis that CBPR is an approach, it's a partnership approach to conducting research where we are equitably involving our community members, organizational representatives, researchers, and others that may be a part of that partnership in all aspects of the research. So the key there is that CBPR is involving everyone in all aspects of the research. Also, all the partners that are involved in the partnership approach to research are contributing their specific expertise. And so making sure that those partners are understanding, are given the voice to share their expertise, but then also understanding that there's shared decision-making and ownership of that particular research project that's happening. And that's ownership and shared decision-making from all partners that are involved. Okay, so when we think about CBPR, kind of where does this whole approach originate from? Well, there's two historical traditions that CBPR comes from. So the first is action research, which was developed by Kurt Lewin. This is a more northern, more pragmatic approach, or traditional approach, if you will, to conducting research, in that there is a phase of planning. There's the phase of, once we plan, we act on that plan, and then we investigate the results of that, the actions of that plan. So that's more, again, that pragmatic approach to research, but nonetheless, action research. The second historical tradition is from Paulo Freire, which is one of my favorite authors. He wrote the book, The Pedagogy of the Oppressed. So if you have a chance or haven't read it yet, I would highly encourage you to read that book. But he has a more Southern emancipatory, tradition to addressing research, which is also known as the participatory research or participatory action research. And the phases or the steps here is really listening to all the partners that are involved, having dialogue about what you heard, then being able to act, and then being able to reflect on those actions, and then repeating that process all over again. And again, this is a little bit of a different approach from the pragmatic action research, in the sense that it's really allowing people to listen to one another, be able to dialogue about what those differences or those similarities are, create an action or create a plan to act on, and then reflect on what that looks like and how do we make it iterative changes. And you'll get to see some of both of these perspectives as we talk about the key principles of CBPR. So as I said, that there's these two historical traditions that CBPR was developed from. And so out of those two principles, or excuse me, those two perspectives, there's some shared core principles that ultimately make up CBPR as an approach. So of course, there's the participatory aspect of CBPR. There's also the cooperative aspect, in that, like I mentioned earlier, we're engaging the community and the researchers in this joint process in an equitable fashion. There's also a co-learning process related to this. Researchers are learning from community are also learning from researchers. And so that co-learning process happens throughout the approach. There's also a focus on systems development. This systems development can be for the actual partnership itself or for the research, depending on how that works out for that particular research project and the context of that project. Also, it builds local community capacity, in that sense that sometimes you're going to have partners that could be involved in the research process that aren't very familiar with that process. So we're building capacity for them. But the same also goes for researchers. That capacity is built that they may not know as much as they thought they knew about that said community. And there's not, you can't know everything about a specific community as well, unless you live within that community. And so it's an opportunity, again, to build capacity, not just from community side, but also from the research side. The CBPR approach is an empowering process. It helps for participants to really increase control over their lives as they participate in that research, in just more than being a study participant, right? If we're participating in all aspects of that research, they're learning about this process. This process is empowering, making them feel that they have more control over their lives when they may not have felt that way before. And then, of course, there's this balance between research and action. Typically, when we are doing research, we have our research, we have our results, we disseminate those findings in some peer-reviewed publications or professional conferences. But then what happens after that? The CBPR approach allows for us to be able to take action on what we find in that research that's at a speed that's more fitting for the community to be able to see benefits come out of it than if we wait for that research to take off years and years down the road. In addition to the two historical traditions that I mentioned with regards to action research and participatory action research, there's also methods and goals of the CBPR approach taken from the feminism, post-structuralism, and colonialism perspectives. In particular, from those perspectives, the CBPR approach includes a way that people can start to analyze their personal lives in relation to the different structures that exist, whether those structures are overt or those are hidden structures. But the goal is that they're able to start to look at their lives and how those different structures could potentially control their lives within the setting of that research. So having this approach allows that research to take on a different meaning for that said community. We also take from these three different perspectives that we want to celebrate the strengths and agency, and not just necessarily focus on the fact that there's a problem that needs to be addressed within a said community. So it's not just looking at the deficits, which is typically in research, that's what we're doing, right? We're trying to fix a problem, we're trying to address an issue, but really also thinking about what are those strengths in that community that we can leverage? What are the agency that is available for leveraging as well? So just making sure that we're not looking at it from just a deficit perspective, but that there's also assets that are that should be identified, recognized, and celebrated. Also, this approach allows us to be working for goals of social justice. Yes, we do have our research outcomes that we want to address, but we also want to make sure that, again, going to that action piece of the approach, the benefit of this approach, is that we also want to make sure that we are addressing those social justice aspects that most communities may have in mind when they are participating in the research. And then also, we want to make sure this approach allows us to really undermine the idea of objectivity of science, in the sense that it allows us to account for the different contexts that we may not sometimes account for when we are conducting research. We need to be able to think about the political, the sociocultural contexts that are related to that work that our research is actually embedded within. How does that context really affect the work we're doing? And then also the knowledge of the people that are living within those contexts. What is it like to try to live in these contexts when these certain public health or other type of health issues exist? So thinking about all those perspectives and how we tie that up into creating and developing the CBPR approach, it's important to understand that there's specific characteristics related to this approach. Again, it is an approach. It's not a research method or design. Typically, that's a common misunderstanding of community-based participatory research, is that people call it a design or a method, a research design or research method. It's not. It's an approach to conducting a research method or specific research design. There's a focus on a population, which I assume that's why a lot of you are here, is to really kind of understand how can this approach be used to focus on a population level health issue. It takes place in a community setting. It is about fully partnering with the community. And when I say fully partnering, again, that is having community involved beyond just the recruitment and participation in the actual implementation of said intervention or data collection, if you will, but that they are a part of it from the very beginning to the very end. Okay, so those are the characteristics of the CBPR approach. But why do we even want to leverage something like this for research? Well, there's a number of different reasons why that I'll quickly run through. First, it really helps us to enhance the relevance, the usefulness, and the use of the research data by all partners involved. Typically, what we've seen historically what we've seen in research is that it's typically mostly useful for researchers, and that information doesn't always get translated back or even shared with the community that helped to create or collect that information. And so this is an opportunity for there to be some relevance and usefulness and use of the research data by everybody involved in that particular project. Also, it helps to join together our partners that have diverse skills, knowledge, expertise, and sensitivities that really help to address much more complex issues than what sometimes we fail to realize. And you know, this is also the idea of team science, and that why we decide to come together and try to have this diverse skills, knowledge, and expertise, because we're really trying to make sure that the project is innovative, it's sustainable, and is that something that can have long-term effects for that particular issue. Also, CBPR helps to improve the quality and the validity of that research. While we might have the perspective of the researchers, which is fantastic to have, there's also the perspective that the community may bring in that will further enhance the quality and validity of that research. Also, we do it because it benefits the community, and it benefits the community sometimes in a much quicker way than it could if we wait for those benefits to take place, because sometimes research takes time in order for us to really see the relevance or even the benefits of that research for those said communities. Also, leveraging this approach helps to create this theory grounded in social experience. So it's really putting us right in the real world setting, attempting to address an issue that, you know, may have only been seen outside of that real world setting, or may have only been efficacious outside of that setting. It helps to really better inform and have more effective practices that are guided by these specific theories that we typically use every day in the research that we conduct. And then it also overcomes the distrust of research, especially on the part of communities. I'm sure many of you have heard of the history of research, not only in our country, but globally, of how that distrust has been created through different research projects, such as the Tuskegee experiments, or even the sterilization of American Indians as well. So there's a number of different examples, but the point is that CBPR is an approach that helps us to try to overcome that distrust and really start to create more innovative and sustainable research projects that really help us to address or even eliminate the different health disparities that we typically encounter every day. This approach also helps us to bridge cultural gaps that typically would exist. It helps us to understand one another. It helps us to understand context. And again, like I said, we learn from each other on a number of different levels, but specifically we learn from each other culturally. It also helps to overcome what we typically will see, or maybe not necessarily see so clearly, the fragmentation and separation that can happen to an individual that participates in research, specifically related to their culture. And what this really does, the approach really does, is help a person to not have to separate themselves from their culture to be a part of a research project, but that they actually bring that in, that experience in, and it helps to elevate that research in a way that may not be elevated if that person or those ideas were not included related to culture. Also, it provides additional funds and even possible employment for community partners. Again, remember I said an aspect of the approach is that we're building capacity for community, and in building capacity, that allows them to develop a skill set that would lead to maybe additional funding or again, possibilities for employment. Also, there are indirect and direct effects on health that come from leveraging this approach for specific communities or the said communities that are part of those projects. And then lastly, it involves communities that have been historically, systematically marginalized and excluded, with the idea that we are attempting to reduce and eliminate that marginalization. So really being intentional about involving these particular communities as we continue to conduct research. Okay, so what I want to talk about next is try to go as fast as I can, but also still giving you some clarity about each of these principles related to CBPR. So like I said, CBPR is an approach. It is not a method, a research method or research design. And so I'll talk a little bit about how, again, these key principles of CBPR are applied in actual research projects, but then also talk about what do these principles mean to you in terms of trying to implement them in any of the research that you currently or in the future plan to do. So here's the first 5 of 10 key principles of CBPR. We're recognizing community as an entity. We build on community assessments. We facilitate collaborative partnerships. We integrate results into action for community change. And then, of course, we recognize the inequalities and differences. So let me go through each of these one by one. So first, we recognize community as a unit of identity. If out of all 10 principles, this is, of course, not just the first principle for no reason. Obviously, it's important to really understand that the community is a unit of identity, both as a collective unit, but also as individuals. We need to be able to understand the sense of identification and the connection to other members. What are the common symbols or systems? What are the shared values and norms? What are the mutual influences for the said community, common interests, etc. So the goal really is trying to understand and define that community. Because in order to really take off with your research project and understand that you have everybody that needs to be at the table for your specific work, you need to be able to understand these elements in order to really define and recognize community as that unit of identity. Again, this can be, the community can be centered on a defined geographic neighborhood, but it doesn't necessarily have to be that. And what I'll do is I'll share with you an opportunity for you to learn a little bit more about how to define communities, which is beyond the scope of this presentation today. But ultimately, from this key principle, the goal is really to identify and work with the existing communities in order for you to identify and or strengthen that sense of community by collectively engaging them in the research process. The second principle really builds on the strengths and resources within the community. So as I mentioned, we don't want to look at community from a deficit perspective, but we really want to look at community from what are the assets and the strengths that are brought to the table. We want to be able to identify those things. We want to be able to identify the relationships that currently exist within those communities to really help understand how do we go about addressing the health concerns together. So this could include different skills, like I had mentioned earlier, assets, different networks of relationships, how we come to cooperate or mutually commit to all aspects of that research. And if there's any mediating structures that are existing that could either be a catalyst or play a role somehow in affecting how that research is conducted. So the ultimate goal here is really, for this particular principle, is to recognize and seek support for those different support or expanding those different social structures and processes to help improve health. So understanding, again, the needs, but also understanding the assets that are available within that community that can be leveraged in that research process, research project. The third principle, again, is facilitating the collaboration with those partners in all phases of the research. This is where there is not only just equal control, but equitable control over all phases of the research. This could be including things like your problem definition, data collection, any interpretation of the results, or even applying the results in that said community to address whatever community concerns. And that goes back to that action piece in those two historical traditions that really help to build or develop this approach. So making sure that they're involved, like I said, in all aspects of the process. I will say, you may have individuals or groups who are not necessarily members of or identify with that said community. Oops, I'm sorry, I didn't mean to do that, but that's okay. The point of it is that we want to make sure that we're involving everybody in the process. And in doing so, we want to make sure everybody's voice is heard or they feel heard. And if they feel heard, then typically they are being heard, and they are being heard by action. So being able to show that not only am I hearing you, but I'm showing you I'm hearing you by making sure that we make the appropriate changes to the research process, research design, whatever aspects of the research needs to be reviewed and potentially revised to include those perspectives. The fourth principle is integrating the knowledge and action for mutual benefit of all partners. Now, I will say this is not always, you may not always incorporate a direct action component for this. So for instance, there might be a commitment to integration of results with community change and efforts. And there's all these intentions that all parties involved will benefit, but sometimes you have to make adjustments. And the goal there is just making sure that you're, again, always thinking through, always making adjustments when necessary, but also not at the price of, jeopardizing the integrity of the research. But again, these are conversations that happen in the partnership in order to make sure that we're integrating the knowledge and action that's in a mutually beneficial way. But ultimately, this principle is just trying to build a broad body of knowledge that's related to health and well-being, but also making sure that we're integrating the knowledge with community and social change efforts that also work to address the concerns. So again, making sure that everybody's expertise is valued, recognized, and included in that development of the research as it continues from beginning to end. Okay. The fifth principle is promoting co-learning and making sure to empower people in this process to really address those social inequities. So as my community mentor back in Los Angeles would tell me, the late, great Dr. Loretta Jones, we really want to make sure we're having what's called that reciprocal transfer of knowledge. It is not just about the researchers teaching community, but community is also teaching researchers because they have knowledge, they have skills, they have capacity. And of course, because we're using this approach, there's shared power. So it's not looking at the researcher as the person that's in charge, but that we're looking at it as there's a co-learning and co-leadership process or shared leadership process that's happening. So we want to make sure in sharing that and in sharing about in co-learning, excuse me, that we're acknowledging that there's these inequalities that do exist. That's the whole purpose of having the co-learning take place, because once we acknowledge those inequities, we're able to really start to empower everyone involved, not just a community, not just researchers, in ways that help to shape the participation and influence in this research process, as well as the action that would take place after that research process. So that's the first 5. So here's the back 5 of these 10 key principles as well. So we also have to consider or think about considering, depending on your research project, how CBPR involves a cyclical and an iterative process, how to address social determinants of health, making sure we think about how we disseminate our findings, and then the fact that the CBPR approach involves a long-term commitment. And then lastly, which is probably the newest of all the key principles, addressing the issues of race, ethnicity, racism, and social class. So let's talk about each of these quickly moving forward. So as I mentioned, involves a cyclical and iterative process. Basically, our projects begin with partnership development. And again, this isn't the scope of this project, but there are other presentations or talks that we have planned that talk about how we develop these partnerships. But basically, we always begin projects with developing a partnership. This helps to include all stages of this helps to include the partners in all stages of the research. And then it also helps us to think about how we can create a sustainability plan for that research, and then reinforcing the partnership by getting involved in this cyclical and iterative process. So what is this process? So the process, like I said, includes the partnership development and of course, maintenance of that partnership, community assessment, being able to define the problem collectively. So again, it's not the researcher coming to the table and saying, here's the problem, but you could come to the table and say, here's the problem, but is there something missing? And that's where the conversation starts about how do we now reshape or refine that problem definition based on the perspectives of everybody at the table. Also, development of the research methodology is a part of this cyclical and iterative process, data collection and analysis, interpretation of the data. Basically, these are the steps of the research process, right? Making sure we determine the action and what the implications of those actions are of the research we're conducting together, disseminating the results, and then of course, the sustainability of it. So making sure that there is a cyclical and iterative process for these different steps related to the research. The 7th principle is making sure we address health from both positive and ecological perspectives. As I mentioned earlier, typically we look at research in terms of deficits or something we're trying to address, solve, if there's a problem. But we also want to make sure that we address health from a positive model where we're emphasizing a holistic approach to well-being. Also, we want to think about the different factors related to the ecological perspective. I'm not sure how many of you here are familiar with that, but basically there is the different factors such as biomedical, the social factors, economic factors, cultural factors, historical, and then a political, looking at those different factors and how that can influence health in a way that would have an impact on how that research project is executed. So think determinants of health, or social determinants of health, which is more of a common phrase rather than thinking about it from an ecological model of health. The eighth principle is disseminating findings and knowledge gained from all partners. So again, this is just being more intentional about how we disseminate. Typically, as researchers, we disseminate in the areas that help to get us promoted and tenured, right? We publish in peer-reviewed journals. We make sure we present at professional conferences. We share knowledge with our research colleagues. However, we want to make sure we're disseminating knowledge to all partners involved when we use the CBPR approach. The language has to be understandable and respectful. We need to make sure that there's ongoing feedback about the data and how we're using those results from the research to help inform action. We want to make sure also that researchers are consulting with participants prior to submission of any type of publication that is being developed. Making sure that we acknowledge the contribution of the participants, and then develop these peer-reviewed manuscripts in co-authorship with your community members. So really, again, being really intentional about dissemination. And it takes a little bit more work in terms of approach, because we're not just disseminating to an academic audience, but we're also disseminating to communities. So those are going to look different. You're going to present results different. And sometimes you're not going to always be writing it, but you're going to be having oral presentations, community presentations. And so just really trying to be intentional about how you share the findings from that work. And of course, this is just an example of one of the publications where we talk about and we co-wrote how we developed built and sustained, I should say, our community academic partnership when I had my tenure at UCLA with their CTSA there. The CBPR for the ninth principle requires this long-term process and commitment to sustainability. So we really want to remember the context of the negative experiences that have historically happened for many communities with respect to research. So we really want to make sure we're establishing this and maintaining trust with our partners. And that's why we really conduct CBPR, because it helps us to establish and maintain the trust with our partners, but also it helps us to reduce these health inequities that primarily or the community prioritizes as a health issue. So we want to make sure our commitment is beyond just that particular research project. We typically engage our community partners for a specific project. Hey, I need some community partners for this. You know, who would those folks be? Keeping in mind that when you do engage community partners, this may be a spinoff for other research projects, or at the end of that funding period, it doesn't necessarily mean that, okay, it's been great that we work together, see you another time, but that we really still maintain those partnerships, because it allows now for the door to be open to extending the work that you started with those community partners, or developing a new project with those partners or other partners. Having that willingness to continue that partnership even without funding is super important. The citation I gave on the previous slide talks about how we sustained our partnership without funding. So we didn't even get funding the first, I think, 7 years of that partnership until they were able to secure the funding for the CTSA, and then everything took off. But the point is that we had very little funding. I won't say any funding, but we had very little funding to sustain it. But we did what was necessary to maintain our partnership. And again, this is not the scope of this presentation, but there are opportunities to learn about how we can sustain those types of partnerships. There's no set time for long-term. The emphasis is really on developing the relationship and commitments beyond any one project. And the last two bullet points here are important, because you want to make sure that the commitment to the relationship among the partners or their organizations, even if the specific partnership may not continue, that the partnership that you have continues. Like I said, Miss Loretta used to tell me, you know, sometimes people have to get on the bus and people have to get off the bus. And sometimes we have to kick people off the bus, because not everybody's on the bus for the reasons that that partnership came together in the first place. So making sure that that commitment to continuing to have that bus available for people to get on and get off, as long as the bus keeps moving. And then also, again, that continued collaboration and support as needed and desired to continue to move to maintain that relationship, as well as, again, other projects. And then the last CBPR principle is regarding addressing issues of race, ethnicity, racism, and social class. I think more than ever, this particular principle is important given what our country has been going through in the last couple of years with the pandemic, as well as the racial reckoning that's been happening. But we really want to understand that CBPR is an approach that can really help us to leverage cultural humility. I know we hear a lot about cultural competency and cultural sensitivity, but the difference between those and cultural humility is that we understand that we can't fully master another person's culture, right? That we are humble enough to come into this space and say that, I don't know everything, but I'm here to learn. And you're making a commitment when you are committing to using this approach. You're making a commitment to having some self-critique and some self-reflection that happens. There's a lot of biases that we hold. There's a lot of things that we need to examine about our own selves that help us to understand how we may be contributing to power imbalances, how we may be able to remove or think about those things to better establish and maintain an authentic partnership. And then also critically reflecting on all these isms. It's not to say that you are a classist, you are a racist, or anything like that. It's just to say, what are these isms and how do they operate, and how can I work as a researcher, as well as with my partners, to delegitimize this particular ism. So the benefits of doing this, of implementing this particular principle is that it helps us to develop a more complete and less biased understanding of the social process. And then it helps us to enhance our rigor, our relevance, and our reach. There is a common misunderstanding that the CBPR approach takes away from the rigor of science, but actually it doesn't. It helps to enhance our rigor. It helps to enhance the relevance and even the reach of the work that we're doing. So these are all wonderful principles, but we need to be clear about how these principles are used in the approach. So we need to be clear that no one set of CBPR principles is applicable to all partnerships. So just because I went over all 10 of these does not mean that you need to apply all 10 of them to your specific research project or projects. It's going to be, this is a guide. This is a way to guide you on how to approach community, right? So it's not saying that I need to I need to implement principles 1 through 10, but it may be most important to implement principle 1 and principle 10, or whatever your particular research context calls for. Also, it's important to understand that when leveraging these principles, it's a partnership, and the partnership must define its community. That is principle 1, right, that we discussed. So we need to make sure that we are defining that community. And sometimes you might have to define that community at an individual level and then come together and combine your definitions of community to come up with a shared definition that everybody can agree on what community is for this particular project or issue. All partners have to be involved in defining what a collaborative, equitable partnership looks like for your partnership. It's not going to look the same for every project, as I mentioned. And you need to think about not only how to define that, but how to make that happen. What does that look like? What are some measurable metrics, which is the last bullet point over on the second column? What are some ways that we can evaluate how well these approaches are being leveraged? Or excuse me, how well these principles are being leveraged in this approach. We also want to make sure that we know that everyone's not involved in the same way. Although there's shared leadership, there's going to be places or areas in the research that the researcher may take the reins, or the community partner may take the reins, or they decide to split it up in some way that there's some shared leadership to move that particular phase of the project forward. Making sure we establish procedures for dissemination, recognizing and valuing those priorities that are identified by the community. So really, again, not just kind of being serving your purpose in terms of what is necessary for the research you want to continue, but also making sure we recognize and value that those priorities or those elements that you may not have considered in addressing, or excuse me, defining the problem that the community is asking you to consider. and vice versa. Working with and making sure that there's cultural and diverse partners involved in the process. The partnership size is going to need to be decided by and what's most appropriate for that said community. And then recognizing that the CBPR principles, that those CBPR principles do not necessarily dictate the research design. Again, this is an approach to help guide the partnership development and how that partnership can be leveraged throughout the research process, but not necessarily that it's going to dictate what research design is leveraged. And then, like I mentioned, we want to make sure we're continuously evaluating how well these principles are being followed. So let me wrap up then with some quick examples of community-based participatory research projects that I have worked on in my time. So I briefly alluded to this earlier in the presentation, but the Healthy Community Neighborhood Initiative, also known as HCNI, is a community academic partnership, or was developed out of the community academic partnership in South Los Angeles. And this was literally a shared leadership CBPR approach in the sense that we came together, we developed research questions together, and all the way through the research process, community was involved and had a strong voice at the table. And in fact, HCNI continues today, even as I'm no longer necessarily a part of that team, although they tell me I'm always a part of the team, which is great. But basically, we published a number of different manuscripts about this project, but we co-wrote the research questions together. We co-developed the research design, in particular, how we decided we were going to collect the data. The community really weighed in heavily on the research design because they felt like what has been traditionally used has not been necessarily working for their community. So we really worked to develop that research design. And this goes back to the principle of having that long-term commitment and being willing to have that commitment, because it did take us some time to really work through what this design would look like, but it allowed us to have a level of rigor that we initially didn't have when we proposed an idea for a design starting out. Also, there was a lot of bidirectional training for community and academic research team. So we would work together and we would train each other. So we would train, the community would train the researchers about what not to do when we're going in the community to collect data. We would train the community about what should we do when we actually get into the home to collect data in a way that's standardized and that everybody's doing it with high fidelity. So it was really a collaborative, shared leadership decision-making. And when we had issues, we had a whole system of how we addressed those issues and how the mediation happened, where we had an academic and a community partner who would co-lead those mediation sessions when there was just some static between different partners at the table. And so, we really had a process put in place. We had a process for accessing the data as well. So just really understanding that we leveraged several of those 10 key principles in order to make sure that our project went ahead. So as I said, we were able to disseminate in peer-reviewed publication, which I showed on the previous slide, but this slide just basically gives some understanding of what the project was about. So basically what we did is we wanted to understand and document the health risk and resources of a community in South LA that was by ethnic, so was predominantly African American and Latino. And so the community felt like the data that the local government at that time was collecting wasn't reflective of their community. So they wanted to collect their own data and understand what are the health risks and what are the resources that are available for people that are at risk to take advantage of. So we created a household survey and clinical data collection, which, like I said, the community had a lot of input in. We also had neighborhood characteristics that we gathered or collected, some observations we did, and of course the resource asset mapping was that other part that was really important for community to have. So what we found in our partnership is that we were able to build this framework, which is what I cited earlier in the paper that we published about the establishing and sustaining the 10-year partnership. we were able to build this framework about how we can really assess and document what we were able to identify at the individual, social, and community levels. We were also able to we were also able to collaborate in a way that used culturally and scientifically sound strategies to help us to identify community-centered health and social needs. The second project that I want to mention is Mastermind, and this is a project that I did here in Omaha with one of my community partners, Charles Drew Health Center. We had two aims. One, we were really just testing the feasibility of implementing a mental health intervention specifically for Black fathers. And it was embedded into, this mental health intervention was embedded into an existing parenting program. At the time, it was called Fathers for a Lifetime. The second aim was to really help us to assess the mental health status and daily functioning of the men as they participated in this mental health intervention. So as I mentioned, the academic partners involved here was Charles Drew, and then it's also a part of the work that I do at the Center for Reducing Health Disparities. And so this again was a CBPR. We used the CBPR approach. We established our relationship before this project. In fact, we worked on another mental health project together. And in working on that, we realized that we need to do something more for Black men in North Omaha at that time. And so we ended up coming up with a shared definition of what the public health issue was. And we decided to go for a specific grant mechanism, and we wrote it together. It wasn't something that I took the lead on and wrote, but the community partners helped to write. The writing was the sessions were a little different. It looks different from what we typically do as researchers, in the sense that we met regularly to talk about what we should include, how we should include it, how this should be worded, those types of things. And then of course, the study implementation we shared in that. Again, it was a feasibility. So we looked at embedding that CBT intervention with the Fathers for a Lifetime programming that already existed. We included people that had a mild mental health diagnosis that were considered at risk or low daily functioning, and then they had to reside in specific zip codes because we were trying to focus on the area that had the most disparities or most need for mental health services. So this kind of just explains how we did it. So we had a total of 28 folks that are 28 Black fathers we screened, but ultimately with a number of different challenges that we had with this project, we ultimately were able to get 5 men to complete the entire study, meaning that there were more folks that kind of went through it, but they didn't complete every piece of the study for a number of different reasons that are listed on the slide. And we did publish those results as well in the American Journal of Men's Health. But basically what we did find is that overall, there was a change in the daily living, or excuse me, the daily functioning of these men, as well as family relationships, as the most notable differences from beginning to the end of the intervention. We did find that it wasn't feasible, specifically in a clinic setting, because it was conducted at Charles Drew Health Center. However, we did note that it could be feasible if we were able to address some of those challenges and barriers we had. And then the men reported those positive improvements that I mentioned in daily functioning, and then we were able to recruit. But we did have a number of challenges that we attempted to mitigate as a partnership. And we did so for the most part, but still had some struggles there, especially around the mental health stigma. And then of course, Black fathers believing that the parenting course was not necessary for them. So I say all this to say that this was just an introduction to the CBPR approach. But if you want to learn more about not only the CBPR approach, but those other levels of community engagement that I mentioned in that first figure I shared with you, our community engagement outreach core of the IDEA CTR has our Community Engaged Research Institute coming up. It's going to be a full day that we are doing in person from 9 to 4 on Wednesday, September 14th. We are planning to discuss some of these topics that are listed here on the slide, and there will be registration coming out as soon as, I believe, tomorrow. So please be on the lookout for that, for you to register. We have a full day session, but we also have some follow-up intensive virtual sessions that will be available for both community partners and researchers. So I highly encourage you to attend, or if you have community partners that you would like to attend, in order to learn a little bit more about community engaged research and some of the topics that I touched on in this session. And then lastly, feel free to email me if you have questions, and we can kind of discuss questions in our last 7 minutes if you have some. But if you are looking to have more of a consultation for any community engaged research projects you are thinking about doing or currently doing and running into some challenges, please feel free to email Emily Frankel or myself, and we can go ahead and set up a time to consult with our team, or you can set it up on your own as well at the link that I provided here. And I believe these slides will be shared with you all as well.